This holiday season is being affected by the coronavirus pandemic for a second year, especially air travel. Hundreds more flights have been canceled in addition to those called off on Christmas Eve. Airlines say they're being hit with staff shortages because of the rapidly spreading Omicron variant. It is now the dominant coronavirus strain, accounting for about 73% of all cases in the U.S. The average number of new cases is up 45% in the past week, and it's more than double what it was on December 1st when Omicron was first reported in the U.S. And the good news, though, despite this surge in cases, new hospitalizations have stayed mostly unchanged. CBS News' Michael George has more.
At airports across the country, flight cancellations were mostly due to airline staff calling out sick or reporting they'd been exposed to the virus.
There's just so much that any employer can do. For those that work in offices, employers can say stay home and work remotely, but that's not the case with airline personnel.
Earlier this week, Delta asked the CDC to shorten isolation times for vaccinated airline workers who test positive from 10 days to 5. At the same time, air travel was projected to spike 184% this year over 2020, with 30 million passing through TSA checkpoints now that it's been more than a year since vaccinations became available.
We're at much lower risk this Christmas than we were last Christmas, but we still must hang our stockings with care.
Dr. William Schaffner is an infectious disease specialist offering advice for the holidays.
And I hope we're all gathering vaccinated and boosted. And then in addition, before we all gather, many of us are getting a rapid test on Christmas Day to make sure that we're all negative. Then we can share the joy in a much more relaxed fashion.
But with so many not able to take off, there was more frustration than relaxing.
The machine's not working right, and it's just terrible.
It's awful. It's awful.
My siblings and my parents, I think they're a little bit stressed out right now trying to figure it out.
Even as many prepared to travel by getting tested.
I think if they've been tested before they've gotten on the plane, then I think you're in really pretty good shape.
But as predicted, Omicron spreads fast. New York reported nearly 45,000 new cases Friday, a 14% jump from the day before, breaking records for the 7th time in just over a week. In Los Angeles, the number of daily cases tripled in 3 days to nearly 10,000. In many places, testing is free. But what about holiday get-togethers for people who aren't tested?
So let's all gather together, wear the mask, keep social distancing, except during the time when we're eating.
And religious services in many places are taking extra precautions, with more churches offering online services this year.
We are having the masks available and we are distancing so that we can make sure that Christmas is not only merry but is safe.
For more, I'd like to bring in Washington Post health and science reporter Fenit Nirappil. Thank you so much for being here. We have so many questions for you. One of the biggest pieces of advice, as you just heard, is to get tested often before traveling. But getting at-home test kits, it's very hard. So you've got long lines at COVID testing sites. How could this affect the spread of Omicron?
Well, when people don't know their status, they're in a position to spread Omicron or spread COVID, because remember, it's not just Omicron that we're dealing with here, but Delta as well. So having those challenges with testing availability and access makes it harder to rein in this pandemic, because you want people who have those mild cases, who aren't sure if it's just a sniffle, if it's just a backache, or if it's Omicron, to know their status and prevent themselves from spreading. I mean, for me personally, I'm spending Christmas here at my apartment, and we decided to skip traveling because my PCR test came back indeterminate and I had symptoms and I wasn't able to get a rapid test in time before hitting the road.
Oh, wow. Well, we hope you feel okay. Wow, I know. And we're also, in my family, we're just kind of keeping it low key. This is our second holiday season with COVID. It's very different this time around, but still, no secret, we're kind of burnt out. Who isn't? So what can people do to ease the effects of what we're calling pandemic fatigue?
I think one important thing to hold on to is that the pandemic hasn't stayed exactly the same this whole time. We're dealing with a different beast right now, and we have the tools to both protect ourselves from getting infected, and we've had major advancements in science that makes it so that if you are infected, if you've been vaccinated or received your booster, you will have extra protection. There are new antivirals on the markets that will make sure that if you do end up in the hospital, you'll have better protection than earlier. And the downside of this Omicron variant is that it's highly transmissible. But the upside of that is that because it's so transmissible, as you were showing with the doubling times in Los Angeles and New York being especially rapid, that also means that these waves can come back faster. So for me and my family, we reached the point where we decided, they're up in northern New Jersey, which is an epicenter right now. We decided it's just better to hold off, and we'll do this in late January, late February. We're not freaking out about it because we've been through this for 2 years. So we know that things get better, things ebb and flow.
They absolutely do. You're right. I could just remember last holiday season and what we were feeling back then. So here's the thing about Omicron hitting at this point. It's really in the midst of the cold and flu season. So what are the concerns about both the flu and COVID, having a post-holiday surge, and how prepared are hospitals to deal with this?
So even though you may have seen the headlines about how Omicron may lead to more mild disease, well, first and foremost, we're not quite at the position that we can say that declaratively, but the timing is bad because it's flu season. There's other coronavirus cases out there. There's other respiratory viruses among children. And as a result of that, hospitals are bracing to be hit with a lot of patients all at the same time. And even if it is more mild and there's a smaller hospitalization rate among the people who are infected right now, when you have a lot of people who are infected, that can still be a lot of people at the hospitals at the same time. So hospitals are bracing for the worst. But like I mentioned earlier, there's a lot that's been improved over the last 2 years. So hospitals have access to masks and to other resources and protective equipment in the way that they didn't in the early days of the pandemic. But one area that's still a big area of concern is staffing. Because again, even if Omicron is mild, but if people get infected, they can't be coming in and serving patients on the bedside while sick and infectious themselves. So that's a concern that a lot of hospitals have, whether they're going to be dealing with big staff call-outs and quarantines. And that's part of why other concerns were addressed when the CDC reduced the quarantine protocol time.
Yeah, and also, of course, the airlines are dealing with that same kind of issue. We really appreciate you making time for us today. Fenit Nirappil, thank you so much.
Thank you for having me.